Hello, I'm Dr. Stephen Ezra West, nicknamed Dr. Ez. Welcome to the Power Heal Workshop. We're going to be covering the whole body from head to toe as far as knowing how to target the activation of your lymphatic system to heal the body. We have to give disclaimers with the nature of the techniques that we're using today. You have to know that there are governing boards, legal entities that regulate, that really regulate people, especially in the United States. So we just want to say that we're not here to diagnose, prescribe, treat, do anything that would normally require a license. And feel free to consult a physician if you really feel like you have that need to do so. Consult both sides. At least we give ourselves credit in this one. Anyway, so we have a disclaimer on our website. It'll help cover a little bit more of this, but here we're posting up on the screen. So you have a little visual of a disclaimer. And now that we've got that out of the way, we're going to have fun all day targeting from head to toe. One technique after another, we're going to be breaking them down step by step. So enjoy the journey. Does anybody have problems with their knees? Okay. I had one of the worst knee injuries anybody had ever seen. There's your ball back. I was sideswiped by a wave runner out here on the lake. And I thought I'd lost the guy because I had his ex-girlfriend on the back of me. And he was kind of tailing around. And so I just went like straight shot, open full blast for as far as I could go till I started getting close to the shoreline. And it was time to make a turn. And I thought he was just history. I didn't even bother to turn to see if anybody was there. And because of the sound of the engine, I couldn't hear his over mine. So I made a hairpin turn to the side and stopped. And he was right there. And he just let off the gas and then turned the jet. But they don't turn without the gas, those jets. That's how they work. So it's illegal to follow anyone so close because of that. He just came right into me. You know, those wave runners come to a nice, pretty good point. I don't know, the rubber plastic's about that thick. I was hit right at the side of my left knee by his wave runner. I got 2 compression points. I had a hairline fracture at the top of the fibula, and 2 compression points instantly where I was hit. My knee smashed in the whole side of the wave runner I was sitting on, split it up from end to end, and knocked it off its chassis. Both wave runners totaled with my knee in between them. My dad went and looked at him. He said, "You don't want to see the wreckage. Trust me, don't even go see it. You've got enough to deal with." Well, I held on to my leg, and at first, I couldn't feel anything below my knee. There was so much pain. It was like 2 sledgehammers coming together on both sides of the knee, and I didn't know if it had been severed or not. And so I had all these thoughts running through my head really fast, and reached down to feel that it was still there, and I was like, thank you that it's still there. And I grabbed on and just held it. Luckily, I had a life preserver on, so I didn't have to wade water with my arms. And I just held it until a boat finally came to fish me out of the water, which was a while. And then when I got out, I looked at my leg, and there were 2 purple lines going from my knee into my foot. What does that tell you? Internal bleeding. And it was a good thing that I was at least holding on. And then I elevated it. If I'd have known that was really going on, I would have elevated it more in the water too. Elevated it right away, and I had a little girl. She didn't know what she was doing, had never met me before. I didn't know these people who'd fished me out. I just commanded her, do this, do that. At that point, there wasn't an option of what was going to happen. I was going to just have them do it. And lucky me, she was willing to follow my lead. So she just started stroking the whole length of the leg. As soon as I could, I had them take me home. I had 3 brothers take turns. If one would get tired, I'd have him replaced. But 3 brothers working on me at the same time, all 3 of them, where another brother, one would get tired, then that other brother would take his place. And they'd rotate for 3 hours. So we controlled, within that time, we stopped the bleeding. There was no inflammation. In fact, as soon as I got out of the water, I have 2 scars from where I was actually cut by the fiberglass, and I don't know how deep they were because they were all sealed up by the time I got out of the water. I still don't know how deep they went, still today. They were just sealed up by the subpressure. Just to give you an idea how bad it was, after the x-ray, they said I had we mentioned the hairline fracture, but I also had one of the cruciate ligaments torn completely out of its top insertion. They didn't know which one it was. They could only tell from the x-ray because they had pulled a piece of bone out with it. And I found out it was a PCL, luckily, because they say ACL, you definitely have to have surgery. PCL, sometimes you get lucky, and you can get by with PCL deficiency. So they also said it would take at least 6 months to recover with or without surgery. And I had a camp happening in 6 weeks where I had planned I was going to be doing all this stunning that I'd done. You know that picture that I showed you? I was going to be doing standing back tucks for a week straight. I'd just gotten finished at the University of Utah on Red Squad, which is the one they pay you. It's the top squad in the state, in my opinion, the country for talent, at least it was, for hardest one to get on for talent, to qualify. And I qualified for the squad where they pay you to lift girls up in the air at the basketball and football games. Let me think. Football or be on the sidelines and lift the girls. Well, I just got done with high school camps, 2 weeks of that, teaching the competition level stunts, and we were going to be doing our camp down in St. George in 6 weeks. So I told my Richard T. Jackson, who's locally here, one of the top 3 orthopedic surgeons in the state of Utah, I said, I don't have 6 months. I'm going to have this done in 6 weeks without surgery. And I'm going to be doing this and that. And he says, if it starts locking up on you, give me a call. He wasn't too confident, but I actually was. But I already knew where I'd already been accomplishing. One thing he did say is for the type of damage here, it should be twice its size in black and blue. What's going on? Because he'd never seen it before. I told him what I was doing. He said, keep doing it. All that stuff works. He wasn't going to question me. So he's not teaching any of his patients that.
They're not allowed to.
No, they're not. They're not allowed to.
Disease.
Thanks for bringing that. Yeah, that's the truth. So scared to even talk about it to me. So I haven't been in to see him very much. I've only been in like one other time. And that was after the 6 weeks, where I had done all the standing back tucks, drilled on cue, day after day for a whole week, done all the building pyramids that all go up at the same time. The ones that we do at that level of the game, we just throw everybody up at the same time, 2.5 high. It was the legal limit. So that's basically three levels, and I was basing them. Where do you think most of the strength comes from? The legs of the bases. You bet. Everybody stand up and bend your knees. See how they feel. All right, have a seat. What I did, it was pretty rigorous. I'm going to teach you the basic knee technique that I did, and then some of the more advanced stuff that I did also. There's 2 hollows in the front of your knee, here and here. When you straighten your leg, they disappear. When you open it up, they're open, and your knee is open here from these points. You're right in the knee joint. Can you feel that? Especially from the upper leg, that all the cartilage on the bottom of the femur, you have access to it right there. You've got a ligament in front that sort of prevents you accessing it right directly from the front. So just right on both sides of that. And you want to use this part of your hands, here and here. Place that right over. Take some deep breaths and do a little light fast stroke. And you want it bent, because that opens up the knee from the front. While you're working the front of the knee, it's bent. Then you go to the sides with the whole palm of the hand. It doesn't matter so much if the leg's bent or straight if you're working the sides. But when you're working the back, you want to straighten it up because it opens up the knee from behind. So we work the front, the sides. We always finish off with the back. You can also do this on the back. That's fine. How does that knee feel now?
Energized.
You feel the difference? In fact, you can stand up, and if I like to have you do this before you work the other knee. Feel how it feels. Most of you just worked your worst knee first. It's a better success story when you do the squats first. What about the other knee? And how do you do this for a partner? Let's all pair up. It's different to do it with a partner. In fact, let's bring that chair that I had for the camera. Show you. Who wants to be my demonstration here? Come on up. Which knee do you want me to work on?
This one, because it's the worst.
Okay, both hands in your tummy, take some deep breaths. When you do it for a partner, you're going to use this part of your hand here and here. The way that we're built is kind of form follows function. This part of your hand's easier to use when you're working on your own knee just because of where you can reach it. It's that simple. But this part of the palm is easier when you're taking both hands up to the knee, with both hands on the knee like this. You want them right on the hollows, there and there. And then, watch this. See this action here? It's not straight up and down. I'm not moving my fingers even. They're just kind of, and they're not digging into the back of the knee. They're relaxed. My elbows aren't moving. The tips of my fingers are basically, they're staying right where they're at. I'm kind of rotating my wrist back and forth. This one's kind of in the wrist. See that? And so it's like that. So take a deep breath. And I just worked the front and the sides. Here's the back. How's that? Go ahead and stand up. See how that feels.
Oh my gosh.
Is that better than when you did it?
Oh yeah.
I've had a lot of practice.
That's great. Yeah, that's amazing.
I don't expect you guys to be as good as I am your first time. This one is one of the ones that can take a little more practice to really get it. For some reason, it just doesn't typically come to people quite as easy. So I want to make sure I coach you really well while you're here. Let's pair up. Make sure you get it.
So how often, if someone has a knee problem, how often do you do that? Repeat it.
Perfect question. Minimum, if it's a major issue like bone on bone, minimum on the hour every hour for 3 to 5 minutes. We've always said 5 minutes, but however long it really takes you to bring your knee back into that homeostasis. There's a trick to regenerating cartilage is you combine the power plant technology because your endocrine glands produce the hormones. And then when you do that and create the environment where it's the healthy environment where the cells can get the oxygen, nutrients, and have access to the hormones, somehow that's cracking the code for regenerating cartilage. But I can't make any guarantees as far as what this will do for anybody to regenerate their cartilage. Just check out some of our success stories on that. It's been absolutely amazing. Like Bill Brumbaugh, who's a radio personality that I did a lot of radio shows for. He calls me up one day and he says, found out I'm bone on bone. I'm former military and I've just kind of got a high tolerance for pain. I've been walking around for pain in my knees for years and this doctor says I need a knee replacement. And he says, what can you do for me? I said, Bill, who do you think you're talking to here? He's all, well, who do you think you're talking to here? I'm like, but this is me. He's like, well, but this is me. I'm like, are you willing to do what I tell you to do? Are you willing to follow the system, follow the process, that protocol? He says, yeah, because if you're not, I said, I don't even want to bother wasting my time teaching you. But those who apply it, if you stick it on a shelf, it's not going to do anything for you, type of a thing. But you take it and you apply it. Like Harry here, who did it just right before he came back into lunch, and we checked him, his hips were still level. Otherwise, they may not have been, right? So Yeah, he says, I'll do it. So I started saying, okay, here's what it's going to be. You're going to be working on yourself at least 5 minutes on the hour every hour. You're going to get a timer if you have to. And I taught him this technique. A couple weeks later, he called me back. He said, I went back and they've noted, I went to the hospital or to the doctor again to get checked out again because my pain's gone. And they say the cartilage is growing back in my knee. Then he quit doing the technique because the pain was gone. And guess what?
Came back.
It came back. And I said, oh, how dare you? You said you were going to do what I asked you to do. He says, I know, but I forgot. It's amazing how fast some people forget once they don't have a reminder, naming mainly pain. Most people don't care why they suffer until they're suffering. And that, I'm telling you, that's old paradigm. People have to learn, they have to change that part of themselves. They have to be willing to say, okay, I'm going to take it up a couple notches, and we're not going to wait for the pain to come back anymore. Otherwise, like, well, it just comes back. They're going to go back to their old lifestyle. If you want to change, if you want your life to change, you got to change. You got to do something different. So, does that answer your question? Mm-hmm. Good. Let's get this done then.
After the pain's gone, do you keep it up?
You know, after about, even after 4 to 6 months, if that's what it takes, you still ought to have something for maintenance. That you'd never really just stop doing it, right? That's where you were before the problem started happening, right? All these parts of the body we're targeting. We mentioned the hip. People ought to be working it, whether they feel anything wrong or not. These are things that everybody ought to learn how to do, at least for maintenance, like once a month or something, even if you think you're perfectly healthy, have some kind of maintenance done. I think that would be very minimal. And if you're lucky enough to have a partner, you could be trading and get it done even faster. So it should be part of our nurturing each other. So here we go. Let's see where you're at. This is going to be perfect. Can you guys come over here? Come on over to this chair real quick. I'm glad that I'm going to be coaching you on camera because this is what people do in their homes. They might look at it on video and not quite get it. So let's watch. See how high you are? Where is this part of your hand? It's up here. Where's the hollow? It's right there.
Okay.
You feel it? There it is. Okay. Right there and right there. Now move your hands.
Okay.
There you go. That's better. Now you, hands on the tummy. Breathe. You breathe together. Ready? Visualize the energy coming right into the hollow and right into the spaces of the joint.
Okay.
So you're covering the front side, but it's also coming underneath for everything in the lower part of the leg. So you get the whole inside of the joint. Visualize that energy just pushing right through. Now the whole side of the knee with both palms on both sides. You got some energy points on the sides of your knees that just stimulating them like this, they say helps prolong someone's life because there's some energy points there. You want to be a step ahead of people in sports or in dance or whatever. This is a good way to help do it. Then as you have them straighten their leg out, it opens up the knee joint from behind. And just do a light, fast stroke. Just like this. I do it like this. You can do this way, that way. You can do it both ways. It can come out this way. There's no wrong way to do it, but just a light, fast stroke. It doesn't take much pressure to get results. You can use a feather duster type pressure and get results with the lymphatic system. In fact, some people who can't reach their different parts of the body, they just learn to use a feather duster on them to activate their lymphatics in that area. And then they start getting to feel better, a little more range of motion to where they can reach. There's not as much energy in a feather duster as there is in your hands, but it's an option.
Did you do it like this?
Yeah, sort of, yeah.
I know, it's modified, but...
Like this. Both hands in your tummy. Breathe. Both hands on the sides like this. and the back side. Let's see how somebody else is doing. That's great. How are you guys doing over here?
Really good. Yeah, we're good.
She's like,
I showed him how to done it.
Yeah.
Yeah.
you're just going for the sides?
Right now.
That's great.
Yeah. I did my knee and it didn't, it's like pain gone.
It's great, I love that.
So you got results.
Total results.
Total
This is
results.
my daughter's worst issue is her knees. She's had surgery, but
This one technique's worth a lot of money.
yeah, last one. And then my granddaughter.
A lot of these techniques are worth well more than what we're asking for our whole system,
She has been.
all by themselves.
Her husband's.
Okay, take a deep breath. And
Oh man, it feels like I'm on some kind of, like it's electrical.
That's what you gotta do.
Oh my goodness. Whoa. It's unbelievable. Yeah, it's just.
So it's on the wrist
yeah,
with the movement.
yes, kind of, you'll relax into it. But you're doing great.
Yeah.
You are? Yeah. Both of them? No. Both hands in your tummy. Leave it. Deep breath.
Oh my goodness.
Okay.
So now,
You're welcome.
You're doing it on yourself like this? Or
Yeah.
that type of thing?
On yourself. Go again.
Okay, like that.
It's a little easier doing it this way
Okay.
than pushing both hands because it centers you better. It's easier.
Okay. Give it.
And then the sides and the back. There's no wrong way to do this. But when you refine your technique, you'll find you'll get faster, more powerful results. And it's not just what you're doing, but what's in here and what's in here, right? That's real important to keep remembering that. Any other questions on the knees? Okay, so more advanced stuff, right? I had to, after that first 3 hours, coming back from the hospital, they didn't even teach me how to wrap it. They wrapped it up and sent me home. The only instructions I had is, well, it's wrapped. You don't want surgery, just go home. They were kind of bummed out that I was just having such a positive attitude, I think. I don't know. But I found out really they don't teach you how to wrap. Whether it's a broken arm wrapped in a splint, whatever. They don't teach people how to wrap. They don't show you what your options really are as far as how often you can wrap it and take off the wrap and how that might make a difference. How to even do a light, fast stroke on it before and after you take your wrap on and off. So I would basically, on the hour, every hour, I had my leg wrapped. And the proper way is a little more pressure, subtly decrease the pressure above what you got below. So you don't create a tourniquet effect. So there's still blood flow, right? You want to have it wrapped tight enough so that it's not blowing out on you between your sessions, yet not too tight where you're restricting too much blood flow. There's a happy medium. So with experience, you can figure that out, especially as attentive I was, as aggressive as I was. I set a timer to go off every hour. When it would go off, I'd restart it, and I'd work on my leg over my wrap, the whole thing. I had lost a lot of blood. I ended up with, I was pushing blood around in my lower leg. And I ended up being smart. Everywhere I'd be pushing the blood, my muscles were cramping, and it would cause pain because of the lack of oxygen. It wasn't just dilated capillaries. We're talking about blood running around, blood proteins that are a water magnet. I was really smart. I talked to my father about it too, and we decided take all that blood, push it over the shin bone where it's away from the muscles. I did that as much as possible. It was pretty easy to work with in the beginning. And then after I pushed it there, left it alone, it hardened up, became a cartilage hematoma. That's what they call it. It's just a massive blood clot. And you don't want to work with any blood clots after they're already clotted. You don't want to physically manipulate them. You break off even a tiny piece, you could have a heart attack or stroke, dead. So this was a high stakes situation. Serious. So if I wouldn't have done that early, if I would have tried to do it later, I could have been in big trouble. But I did it right off the get-go. And so without hesitation, the longer you wait, the bigger the problem becomes. And that problem this could be part of what I'm saying, could have to do with blood clots. So I'm talking, you don't even want to wait 24 hours. If you wait the next day to talk to a specialist to get some advice, too late. And most people think, well, you got broken this or that, buy a new one. Plastic doesn't regenerate, metal doesn't regenerate, so it's really not that simple. What I did is, so after the alarm would go off, I'd work for 5 minutes and then take my wrap off and work it for 5 more minutes without the wrap. Every time I take it off, I could feel blood flowing in. I could also feel it kind of blowing up on me a little bit. But then I'd wrap it up again after 5 minutes of the wrap being off, and I'd work it for another 5 minutes. So a total of 15 minutes on the hour, every hour, even during sleeping hours. That's just how serious I was. I knew how bad my problem was, and I knew what I had set my goal as within 6 weeks, right? I wasn't going to wait. And I was doing everything I possibly could, just totally aggressive. Not everybody's willing to be that aggressive. I was. Walking with crutches after 5 days, 2 days later upstairs, and 2 days after that I was taking double steps up the stairs. Within a few weeks I was lifting weights with it, jumping on a big trampoline, but I was still taking it easy. I wasn't doing backflips yet. I was just taking it easy, just a gentle bounce, pretty much, to begin with. Let's get some kind of stimulation going. So, but at least for a few weeks, I was even working during sleeping hours on my leg. 15 minutes on the hour, every hour. And I didn't have anything better to do. And within 6 weeks, I was, again, doing the standing backflips, drilled on cue for a week straight, basing the pyramids 2.5 high, doing all the partner stunning, which, as you could see, was kind of a higher level. That toss cupie took me a little longer just to get that toss cupie back. I wasn't doing it my first day, but I was at least doing everything but that. So everything I was required to do, everything I was being drilled on, I could do. I still didn't have totally regenerated knee yet. I don't do this very often because it's hard on the joints. But I like to have fun. I like to show off a little bit, just for kicks. As far as I know, I still have PCL deficiency, right? But I get to do all the things that I like to do. I've got a pair of jumping stilts out in the car. A couple years ago, started doing backflips on those. How serious do you think I am about maintaining the health of my knees? How often do you think I do it? Not quite every day, but I do it often. Anytime I'm doing anything rigorous, if I'm out on a hike, I do it before, after I get to the top, maybe once during the middle on my way back down, and when I get down to the bottom, when I'm completely done with the hike, I do it again, because I want to make sure that I'm going to speed up any recovery that needs to happen. And it's during the rest period that the recovery is happening. You stimulate the muscles, you actually have little tears in the muscles where out comes some blood protein and water, things like that. Then it's during your rest period, the muscle's actually growing, becoming stronger. So if you speed that up on the get-go, as soon as you're done lifting weights, what do you think that does for people? In fact, if you get down on a bench press, talking weightlifting, and you lift so many weights, depending on the weight and how many times you plan on lifting it, you're going to get to a point where all of a sudden you go to failure and you can't lift it anymore. And if you know how to get the fibers relaxed enough and if you take the origins and insertions and just push them back into place even, because that's one of the reasons why the muscle shuts off. It's like a safety shut-off switch. The origins and insertions are just pulled out of place. If you push them back in, you can drop right back on the bench and lift as much as you did right from the beginning. Does that mean you should? No, you're going to keep tearing your body down. Why? If you turn the muscle back on again, is it in a higher regenerative condition? Yeah, so it's great to know how to push the origins and insertions back in. It's great to know how to get all the muscle fibers in a condition where there isn't any inflammation, lactic acid, any of the poisons, where their life processes are on, they're regenerating. It happens much quicker. So it's pretty cool if you're a high performance type person, which I like to be.
Anything for the ankles?
Yep, that's next.